discuss a rare entity which is called lash ptosis. So you can see in this patient, the eyelashes are pointing downwards in this area. And normally, if we take a section of the eyelid, if the eyelashes, if the eyelid are like this, then your lashes would be pointing upward and outwards, or downwards and outward. But in patients, especially in lash ptosis is the entity which you see in the upper eyelid. And here you can see in these patients, what will happen is, instead of this, when the angle becomes 0 degree, then there's a lash ptosis scale as well, in which they would grade. If it goes up to 0, then it goes to grade 1. It goes down 10 degrees, 20 degrees, 30 degrees. So this is the amount of lash ptosis which you will get in patients with this condition. So why does this happen? Why is the lashes actually becoming ptotic in these patients? So what they say is, either the elastin which is present in the skin and the tarsal plate, that becomes less or changes, and that leads to this lashes sagging behind. Or the other reason is the anterior lamella that slides over the posterior lamella. So eyelid is broken down into two lamellae, the anterior and the posterior. So if these are the lashes over here, then the anterior lamella would have the orbicularis and skin, and the posterior would have the conjunctiva and the tarsal plate over here. So if this was to slide forward, this lamella was to slide forward to this area, this would produce this ptosis of the lashes. So this sliding forward produces this lash ptosis. So what are the conditions which can produce this lash ptosis? I think the most important condition which you're going to show in this case as well is floppy eyelid syndrome, and the other entity is blepharoptosis, which can be either congenital or acquired. That can lead to this lamellar repositioning, while in floppy eyelid syndrome, it's mostly the elastin. Then patients who are using prostaglandin analogs, they can get very thick eyelashes, that is called trichomegaly, and those thick lashes can droop down because of the weight, and that can be another cause. And leprosy has been shown to produce this lash ptosis as well. So let's see, in this case, we have a case in which we have lash ptosis. Just clear this all, and we go forward. And you can see what we want to do. If you want to look at patients, I'm going to just hold the eyelid temporarily, and you see floppy eyelid syndrome, in which usually you have papillary conjunctivitis, which patient does not have, but a very lax eyelid is seen, and these patients have sleep apnea, which is a characteristic feature of these patients. And it has been shown that with CPAP therapy, the sleep apnea would resolve these cases of lash ptosis as well. And floppy eyelid syndrome, you will get this. If you pull on the eyelid, you can see my eyelid is not turning over, but in these patients, it will just flip over. As you see in this patients, they get sleep apnea, and they get spontaneous opening of the eyelid at nighttime, and sometimes they wake up with pain and redness of the eye because the eyelids just open up. And these can be seen in patients with keratoconus as well, because they tend to get that papillary conjunctivitis as well. And what can you do for these patients for lash ptosis? If there's a floppy eyelid syndrome, sometimes you need to do a horizontal lid tightening to make that lid tight. But I think the main treatment is to slide that anterior lamella, or you need to do a lamellar repositioning to get that area of the lashes to move back. And especially in patients with blepharoptosis surgery, when you made the closure of the eyelids, what you would do is you would take the bite. If you're going to do surgery in these cases, you would take the bite of the skin. If this is the eyelid crease over here, when you're doing this, you would make the dissection forward. If these are the lashes over here, you would dissect in the suborbicularis plane right up to the lashes, and when you are closing this area, you would take a deeper suture, or that would slide onto the tarsal plate And then this was, and look at where the lashes are and move the eyelashes up on that area, on that area, just by sliding that area of lash ptosis. So this is an entity which you see not very commonly, but if you are easy to pick up, it will just give you a takeaway that this patient might have a floppy eyelid syndrome. So don't forget to pull the eyelids laterally and you will immediately get flipping of the eyelid. So thank you very much for watching. Please click on the like button and subscribe to the channel. Looking forward to seeing you again.